A new report shows the Department of Homeland Security is spending tens of millions of dollars every year on health care for illegal aliens. But as One America's Pearson explains, the cost of illegal immigration go much further.
A new report reveals U.S. taxpayers have spent $45 million on medical costs caring for illegal aliens after they're caught at the border. Since 2015, the Department of Homeland Security has diverted the funding from operational costs to medical costs. Just since the start of fiscal year 2019, the U.S. Border Patrol has diverted $9 million in operational funding to cover the overwhelming cost of medical screenings and even blankets for illegal aliens. According to the Washington Examiner, the Border Patrol was forced to shift the money when the massive waves of migrants began arriving back in 2015. The screening is usually taken care of on-site, but for patients with more serious conditions, they're transferred to local medical facilities, all at the American taxpayers' expense. That means money, time, and resources that were meant for protecting the border are now being spent on health care for illegal aliens. The $9 million this year has gone towards appointments for nearly 5,000 illegal aliens, with officials estimating Border Patrol agents have spent 50,000 man-hours taking illegals to hospitals and watching over them once they're there. But the medical attention is necessary since many of the illegals coming across the border are riddled with highly contagious diseases, including scabies, cholera, typhus, and various STDs. As of March 6th, Immigration and Customs Enforcement report there are roughly 50,000 illegal aliens being held in federal detention, and about 2,300 of those are being quarantined for infectious diseases. Officials say many of those diseases had previously been wiped out in the United States, including the mumps and certain strains of influenza. ICE health officials say containing the outbreaks is one of the hardest challenges, as migrants who are sick may not appear ill and then spread their diseases as they're transferred to different facilities across the U.S. The U.S. Customs and Border Protection Commissioner Kevin McAleenan says migrants are arriving with illnesses and diseases in unprecedented numbers and are coming from countries all over the world. To deal with this outbreak, Congress passed a bill giving the Border Patrol $415 million for humanitarian relief purposes, aimed at providing medical care for the illegal aliens. Yet the same Congress insists there is no crisis on the border. In addition to the massive healthcare costs, a new report from the Center for Immigration Studies reveals non-citizens, including illegal aliens, use twice as much welfare as American citizens. According to CIS, about 63% of non-citizen households rely on public welfare, while just 35% of American households are on welfare. But the problem isn't limited to illegal aliens, with over half of all foreigners who have become American citizens are on taxpayer-funded welfare. Those on food stamps or using Medicaid are also twice as likely to be non-citizens, with only 21% of native-born Americans using some form of food welfare program. The situation is the worst in California, with some 70% of all non-citizens living on welfare, while just 35% of American citizens use welfare. President Trump has criticized the situation, calling for an end to illegal aliens coming to America just to end up on welfare for the rest of their lives. To combat the problem, Trump has proposed banning legal immigrants from living in the U.S. if they present a burden to taxpayers and don't contribute their fair share to society. Annually, close to 2 million foreigners settle in America every year, though the vast majority are poor, uneducated, low-skill migrants. Under President Trump's plan, American taxpayers could expect to save at least $60 billion every year on welfare, healthcare, crime, and schooling costs for these migrants. Pearson Sharp, One America News.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube. And call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.